Welcome to the deep dive. We cut through the noise, get straight to what you need to know. Today, we're tackling something that's been, well, a bit overlooked. How COVID-19 affects kids long term. After the infection itself is gone, so much focus was on adults initially, and that left a real gap, didn't it? Especially for kids.
It really did. And that's exactly what we want to dig into today. Our mission here is to pull back the curtain on the latest research about long COVID in children. We're talking prevalence, what symptoms stick around, and crucially, how it messes with their quality of life. We'll be pulling together findings from studies around the globe, trying to get you a clearer, fuller picture.
Okay, let's jump right in then. Prevalence. When you look at the numbers, how many kids actually get long COVID? Well, they seem to be all over the place. What's going on? Why isn't there just one clear number?
Yeah, that's honestly the trickiest part right now. The prevalence rates reported, they vary massively. And it mostly boils down to how different studies even define long COVID. It's not standardized. Some say symptoms past 4 weeks count. Others use 2 months. Some even wait for 3 months after the infection. So you might see like a Japanese study using 4 weeks, while an Italian one uses a stricter definition symptoms for at least 2 months, starting 3 months after diagnosis. Just that difference, it totally changes the numbers you end up reporting.
Wow, okay, so the threshold itself changes the statistic. That seems tricky for a health condition.
Yeah.
How do researchers even compare these studies then? And what does it tell us, globally?
It tells us we have to be really careful with those headline numbers. You gotta look at how they measured it. And it's not just definitions. The study design matters too. Was it a snapshot in time, cross-sectional? Or did they follow kids over months, like a longitudinal study? That makes a huge difference. And who are they studying? Kids who ended up in the hospital. Or mostly kids treated as outpatients. That changes the results too. Let me give you a few examples. There was this study from Japan, Ijima and colleagues. It was prospective, followed hospitalized kids. They found really high rates, like 44.9% still had symptoms at 1 month, 37.8% at 3 months, still almost 23% at 6 months. Now, that was way higher than, say, a previous report from a registry in Japan, which found only about 3% in 28 days.
A huge difference.
Right. And the difference was probably because the registry included more kids who weren't hospitalized, milder initial cases.
That is a massive difference. It almost makes it sound like two separate things depending on how sick you were at first. Does that mean how bad the acute infection is might be the key factor, or is it more complicated?
It's definitely a factor to consider, but it is more complicated. We need to compare those hospitalized kids to like the general population of kids who got COVID. So look at this Italian study, Esposito et al. Multicenter study, bit different. They found, a lot of kids, 68.6%, reported at least one lingering symptom, any symptom. But when they used a stricter definition for actual long COVID, that number dropped way down to 16.2%.
Okay, still significant, but much lower.
Much lower. And the authors thought maybe it's because COVID is generally milder in kids, or maybe because the Omicron variant was dominant then. And then, check this out, a study from Iraq, Hussein et al. Looked at kids aged 5 to 12, found evidence of past infection, those IgG antibodies, in a staggering 91.5% of them. So it was everywhere in the community. But get this. Only 4.6% of those kids actually reported long COVID symptoms, and almost all of them, 93.4%, had no symptoms at all during the initial infection.
Wow, okay, the Iraqi numbers, that's really interesting. Widespread infection, but very few long-term symptoms reported. That sort of complicates things, doesn't it? How do we square that low number with the others? What's the real picture?
It tells us it's complex. Identifying and helping these kids isn't about one single percentage. The human impact is there. You see it in all these studies, even if the percentages bounce around. What's definitely clear is that a real, noticeable number of children do have persistent health problems after COVID-19. We can't just ignore it, no matter how you slice the data.
Right. So, okay, if kids are getting long COVID, what does it actually look like? What symptoms are we talking about? Is there a common pattern emerging across these different places?
Yeah, definitely common threads. Across these studies, you consistently see 3 main things pop up: a cough that just won't quit, serious fatigue, and sleep problems. Big time. The Japanese study really highlighted those, plus things like poor appetite and trouble concentrating. Interestingly, you know how loss of smell and taste was big for adults?
Yeah, very common.
Hardly reported in these kids. Some parents had it, but not the children much. Now, looking at the other studies, Italy, the Esposito one, they echoed this, but also really flagged respiratory issues. That was 43.4%.
Yeah.
And neurological or cognitive problems like brain fog, that was 27.7%, plus stomach issues.
Yeah.
And the Iraqi study. Again, fatigue was huge. 85.7% of the kids with long COVID reported it. Cough was 71.4%. They also specifically mentioned post-exertional malaise, that awful crash after minimal effort.
PEM, yeah.
Exactly. That affected over a third of them, 35.7%, plus headaches, dizziness, mood swings.
It is striking how fatigue, cough, sleep issues just keep coming up. Japan, Italy, Iraq. But, I mean, lots of viruses leave you feeling tired or with a cough for a while. What makes this show? This is specifically long COVID in kids, not just, getting over being sick.
That's a fair question. And the Japanese study is helpful here. They specifically look for symptoms related to ME/CFS, myalgic encephalomyelitis chronic fatigue syndrome. This isn't just feeling a bit tired. It's profound fatigue, not helped by rest, where doing simple things totally wipes you out. Plus major sleep issues, muscle and joint pain, headaches, really debilitating stuff for a kid, way beyond normal recovery. And what was interesting, the prevalence of these ME/CFS-type symptoms was much lower in the really young kids, 0 to 6 years old, compared to the older kids, 7 to 17, and their parents.
Okay, that age difference is important. It suggests maybe long COVID looks different in little kids versus older ones. And for those older kids having ME/CFS symptoms, that has huge implications for school, for life, definitely not mild.
Right, and this is where it gets, I think, really concerning. Beyond the physical stuff, the aches, the fatigue, how is this affecting kids' mental health, their day-to-day lives? This is absolutely critical, and the research points to a significant invisible burden. There was a U.S. study from a rehab clinic, Henning et al. They found nearly 40% of their pediatric long COVID patients had elevated scores for anxiety or depression symptoms. And when they looked at very elevated scores, like way beyond typical levels for kids, almost a third showed significant anxiety and depression.
40%.
Yeah.
And nearly a third with very elevated scores. How does that compare to, the general kid population?
It's substantially higher. Globally, back in 2021, prevalence was maybe around 11% for anxiety, 5.4% for depression in kids and teens. So yeah, much higher in this long COVID group. And what's really alarming from that U.S. study, 23% of the kids developed new anxiety symptoms, 17% developed new depression symptoms. These were kids with no previous mental health diagnosis.
New onset. So it wasn't just making existing problems worse.
Exactly.
Yeah.
It strongly suggests a direct link to the long COVID experience itself. Though the Italian study did also point out, fairly, that you can't totally ignore the broader pandemic context, right? The fear, the lockdowns, the social disruption, that creates chronic stress too, which can impact mood, thinking, quality of life.
Makes sense. So, okay, what does all this mean for them just being kids, going to school, playing? What are the real-world impacts?
Well, the impact on their quality of life, QOL, is profound. Remember the Japanese study? They found that sleep disturbance was directly linked to lower QOL scores.
Yeah.
At 1 month, 3 months, 6 months. It just shows how something like bad sleep can really drag down a kid's ability to function and feel okay.
Yeah.
Learning, playing, everything.
Yeah, absolutely.
In the U.S. study, looking at depression, found a clear link. Higher depression scores meant lower overall health-related QOL. Specifically, feeling ineffective, negative about your abilities, struggling in school, not enjoying things anymore, that was a key predictor of really poor QOL. And get this, the QOL scores for these kids with long COVID were similar to kids living with major conditions like cystic fibrosis or even cancer.
Wow. That really puts it into perspective. CF or cancer. It just highlights that complex mix of physical and mental symptoms and how hard it must be to untangle them. These aren't just small leftover issues. They're hitting the core of childhood, like serious chronic illnesses do.
Okay, let's shift gears a bit. Can we predict this? Do we know who's more likely to get long COVID? Are there specific risk factors that make some kids more vulnerable?
It's nuanced. The findings really vary depending on the study, what symptoms they're looking at. For instance, that Japanese study, they actually found no specific risk factors for overall long COVID symptoms in the kids they followed. Not age, not sex, not how sick they were initially, not even vaccination status. Nothing. So it could hit anyone, basically. That makes it harder for parents to gauge risk.
Kind of, yeah, for the overall symptom picture in that study. But interestingly, that same study did find one thing. Increasing age was a risk factor for developing those specific ME/CFS-like symptoms. So not a risk for all long COVID, but for that specific debilitating cluster, older kids seemed more vulnerable. Now, contrast that with the Iraqi study. They did identify 3 significant risk factors: having had COVID before, having had pneumonia during the acute infection, and having a family history of COVID-19. So that suggests prior exposure, lung involvement, severity, maybe household factors could play a role.
Okay, so prior infection, pneumonia, family history. that's different.
Right. In the Italian study, they saw age and gender differences for certain types of symptoms. They found older kids and girls were more likely to have cardiovascular or neurological cognitive issues. And while breathing problems seemed to decrease with age, those neurocognitive issues, fatigue and heart-related symptoms, actually increased with age.
Interesting. So age pops up again, but linked to specific symptom types.
Exactly. And finally, the U.S. study confirmed that if a child already had anxiety or a mood disorder, they were more likely to have higher scores for those symptoms after getting long COVID. But, and this is crucial, remember, a lot of kids without any prior history still developed new anxiety and depression.
Right, the new onset point again. It sounds like the risk factors are just incredibly complex. Depends on the population, the symptoms you measure, maybe even the definition used. No simple answer. Makes guiding families really tough.
It absolutely does. It really underscores why we need that broader view and just more research to untangle it all. And as we wrap this up, it's really important to talk about the limits of what we know right now and where we need to go next. A big one, mentioned in several studies, Japan, Italy, the U.S., was the lack of a control group, kids who didn't get infected. Without that comparison group, it's tough to be 100% sure if a symptom is directly from SARS-CoV-2 or maybe from another virus going around, or even just the stress of the pandemic itself.
Right. So you can't easily separate long COVID from, say, a bad cold season or pandemic stress. That's a big hurdle.
It really is. Another thing mentioned, especially in the Japanese and Italian studies, was not knowing the specific virus variant for both participants.
Yeah.
Different variants, like Omicron, which was dominant during the Italian study, might cause different rates or types of long COVID. Understanding that could be really important.
Makes sense. Variants matter.
Yeah. And then there's vaccination, its impact on pediatric long COVID. Still pretty unclear. Both the Japanese and Italian studies pointed this out. They just didn't have enough vaccinated kids in their groups to draw strong conclusions. So definitely need more research there to see if vaccines offer protection against long COVID in kids. And, basic methodology stuff, those cross-sectional studies like the one in Iraq, they give you a snapshot, but they can't track symptoms changing over time. And relying on people reporting their own symptoms or parents reporting for kids always has the potential for recall bias. Remembering things accurately can be hard.
All fair points. It just reinforces that we need more targeted research, better tracking to really get a handle on this and figure out how best to help these kids. We're still piecing it together, clearly. Lots of missing pieces. So summing up this deep dive, what's the takeaway? Long COVID in children is real. It's complex. It hits both physical health, that persistent cough, the fatigue and mental well-being with real anxiety and depression, and the impact on their quality of life. It can be huge. Sometimes, as we heard, comparable to kids dealing with really serious chronic conditions. The numbers might jump around based on definitions, but the lived experience for a significant group of kids is undeniable.
Absolutely. This exploration really highlights that we need to look at the whole child, their situation, the connection between mind and body. It's definitely not a simple one-size-fits-all thing. The effects linger, and they really demand our attention long after that initial fever breaks. And maybe something to leave you thinking about. How does all this challenge what we usually think of when we call a childhood illness mild? If mild can lead to this level of long-term impact for some kids, what does that mean for us? What responsibility does this knowledge give us as a society to make sure we have solid long-term care and support ready? Not just for this pandemic, but for whatever comes next. Thinking way beyond just getting over the initial sickness.